Now, as the race to vaccinate Americans picks up, some are still saying they will decline to get the shots when their time comes. For some, worries about putting the vaccine in their bodies outweigh the worries of getting COVID-19. But Dr. Eli Reshef writes in an op-ed in the Oklahoman that we need people to get the vaccine to be able to move on from COVID. Being an active anti-vaxxer or a passive one, using caution as an excuse, that's not a luxury afforded to anybody during pandemic times, he says. Dr. Reshef joins us now from Oklahoma City with more on that. Afternoon, doctor. So,
afternoon.
What is your message to people who are against vaccines, or those who are just say they're being cautious and don't plan to get their doses? It's a high number of people, polls show.
Once again, the luxury of saying, well, the vaccine has just been introduced, we don't have enough experience, or if you're actually truly an anti-vaxxer, is not a luxury that we have in this day and age when more people a day die in the United States than in 9/11. Ever since the beginning of December, we in January experienced the worst month of the entire pandemic. So far the United States has had more casualties to COVID than World War II. We're rapidly approaching the casualties in the Civil War, which is tragic as can be. There's a lot of misconceptions about the vaccine, especially about the rapid introduction, but I should say this, and I can back it up. The vaccine is safe, and furthermore, especially in my particular specialty, where I deal with women, where we deal with reproduction and pregnancy and otherwise, having the disease, having COVID in pregnancy, especially in the third trimester, is life-threatening, much more so than having the vaccine at any stage of pregnancy. A lot of people will hide behind the fact that the vaccine has not been tested on pregnant women, but there are plenty of pregnant women that have gotten the vaccine and we do not have any adverse effects, and plenty of pregnant women that got the disease and have gotten very sick, especially in the third trimester.
So if I may follow up on that, as a doctor specializing in reproductive health, fertility issues, there are women expressing fears that COVID vaccine could lead to infertility. Is that true?
It is not true, and unfortunately, this was fomented and advanced by people who were part of the pharmaceutical industry. All it takes is one rumor to really mess up the entire chain of information, because people, when they're scared, are looking for any clues as to whether or not, especially in that case, to take the vaccine. And this was a big vaccine, how should I say, denier. There is some similarity, very little, between the spike protein on the coronavirus and the placental protein called syncytin, but that similarity is so little that it does not translate into any immune response against the placenta or any infertility. Bottom line, there is no infertility caused by the vaccine. There's only disease, stress, economical stress, and clearly we're all sick and tired of it. Listen, as somebody who had the COVID disease, I can definitely empathize, but we need 80% of the population, that includes kids, by the way, to be immune or immunized before we can go on with our lives normally. It takes a while.
So the World Health Organization has come out with advice that pregnant women should not get the Moderna or Pfizer vaccines. As a doctor, once again, working with a lot of pregnant women, what's your advice? What advice do you give your patients on that?
The American College of OBGYN, of which I'm a member, overarching organization of all of us OBGYNs, including fertility specialists, just revised its statement yesterday. And it basically allows to give it to pregnant women. It doesn't recommend it necessarily directly. They cannot do so because the studies on the vaccine were not done on pregnant women. Pregnant women and children are the last people to be studied upon, and we don't have the time frame to study it on pregnant women. I tell my patients, if you have indications to get the vaccine when you're not pregnant, take it when you're pregnant. And I tell my infertility patients, take it now as soon as possible so that you will not have the dire consequences of pregnant women that get the disease.
Makes good sense. Dr. Reshef, thanks very much for joining us.
Thank you, Terry.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.